Hi, I'm Dr. Hirsch. Welcome back to my YouTube channel where we discuss all things midlife, menopause, and hormone replacement therapy. This week's video is all about HRT and weight gain. I'm going to answer the question once and for all, will hormone therapy cause weight gain? Because it's a question that I get all the time at the end of my visits and something I see in the comments. The next thing we're going to address, because I'm going to give it away, hormone therapy should not cause weight gain, is if you find weight gain on your hormone therapy, what can you do to fix this? So if you're interested in that, stick around. If you don't know me, I'm Dr. Hirsch. I founded The Collaborative. It's a private telemedicine practice, and we are available to take patients in almost all 50 states. This is the most wonderful place to get expert care. I also have a new app coming out. It's called Flourish. You can go to joinflourish.app to learn more about how you can get really accessible care. And if you are a clinician, you're gonna wanna check out the Hirsch Academy, where we have amazing courses to teach you all of this so that you can have the career that you love. More about all of that at the end. My standard response to will hormone therapy cause weight gain is no, it shouldn't. In fact, it should actually help you maintain or even lose a little bit of weight. Now, before you come at me, because I already know the comments are going to be flooding with, absolutely, yes, it will. Of course, I gained 20 pounds, 30 pounds. Here's what I want to tell you. In the Women's Health Initiative, this was the biggest randomized controlled trial on hormone replacement therapy. That means that one arm was given placebo and one arm was given hormone therapy, and neither the patients nor the doctors knew which they were getting. In this trial of over 50,000 women, the women who took HRT gained less weight. I know, so I really actually have some leg to stand on this. When we actually look at this in trials, double-blinded and randomized, women on hormone therapy gained less weight compared to women who did not take HRT. Now, the interesting thing in the WHI was there's a standard dose that we use, and we're going to talk about dosage as a problem for why you might actually be feeling the opposite, that hormone therapy is causing weight gain. Secondarily, in that study, the Women's Health Initiative, they found not only did those women gain less weight, but even more importantly, they had less diabetes. This is crucial because this actually tells me, as a physician, what might be happening in the cellular level. So diabetes is essentially insulin resistance. It's when the insulin, which is supposed to take all the sugar out of all the food and out of all the blood vessels and into the organs where it's supposed to go and burn fat, doesn't work. So what happens is that sugar stays floating around in your body. It causes atherosclerosis. It causes weight gain because it gets deposited eventually as adipose tissue and other problems. So let's go back. If you had estrogen, you didn't have as much insulin resistance. You actually maintained insulin sensitivity. If you were in the placebo group, you had more insulin resistance and therefore more diabetes. This important fact shows me that estrogen and insulin talk to each other. As we lose estrogen through perimenopause to menopause, there is more of a propensity for insulin resistance. Estrogen actually helps to keep that insulin in line and working well. So to recap, in the Women's Health Initiative, women who took hormone therapy gained less weight and had less diabetes. This tells me that when hormone therapy is used correctly, you should not gain weight at all. You should actually maintain your weight or even lose weight. Secondarily, hormone therapy often helps the lifestyle changes that are causing women to gain weight. So the most important thing that's causing weight gain is sleep, lack of sleep, not sleep itself, but a lack of sleep. So oftentimes when I'm placing women on hormone replacement therapy, even simply just the act of sleeping better helps the metabolism, helps your mood the next day, helps you so you're not binge eating or carb craving, and in and of itself can absolutely help you lose weight. Sometimes also you feel more energized, more motivated. So you're gonna get to the gym and do your workouts and maintain that mental health and preserve that muscle. So there's lots of reasons why actually in my patients, hormone replacement therapy seems to actually cause no weight gain or helps them to lose about 5 to 10 pounds without doing anything differently. Before I get into what can help you, tell me in the comments below, did HRT actually help you? Because I know it's gonna be flooded with comments saying I'm absolutely a lunatic and of course hormone therapy is gonna cause weight gain. I also want to point out that in randomized trials of birth control pills, actually birth control pills do not cause weight gain. So a lot of this really stems from this bias that estrogen is evil, dangerous, and harmful. And of course, if you're adding estrogen, that's going to cause weight gain, but that is honestly not true. And I'm going to explain this more as we get into what can you do to fix your HRT if you feel like it's causing weight gain. Okay. One of the things that's really important when I prescribe hormone therapy and all of the affiliates who work at the collaborative, this is my private telemedicine practice, we almost always do something called hormone stacking. What does that mean? We do one hormone replacement at a time, whether that's estrogen, then we add the progesterone, then we add the testosterone. It is absolutely crucial in most women to not start all of these at the same time. Why? Because if you're getting a side effect, whether it's your pinky hurts or you're getting weight gain, it's usually from one hormone, not the whole combination. One hormone, not the whole combination, or it's from the dose. So let's start with, what if you started all of your HRT at the same time? What I would recommend we do is actually take you off your hormone therapy and kind of wash things out for about 2 weeks. I know it's gonna stink, but if the stubborn weight gain or the massive amount of weight gain you've had is absolutely really causing you so much stress and discomfort that you're gonna give up on your HRT anyways, let's fix it, because I don't want you to give up on your HRT, because I do think this is fixable. So usually we'd stop it for about 2 weeks and then we reverse engineer, we stack. So start with one hormone. So it might be more common that you start with the estrogen and you give that about 4 to 6 weeks and you sort of see, did that cause any weight gain? Did that cause me to have swollen breasts, or did it cause me to gain weight in my stomach? And if so, okay, it's the estrogen. Maybe you start the estrogen and you're like, nope, I feel great. We add the progesterone. Maybe all of a sudden you notice that's when the weight gain starts, because progesterone can cause water retention and bloating. Maybe it's the testosterone, because testosterone can actually increase your hunger. So you're just eating more all the time, but you didn't really notice it when you never started them one at a time. Because I'm gonna tell you, when there's a side effect from hormone therapy, be it bloating, be it mood symptoms, or weight gain, it's usually from one, not the combination. And if you can isolate which one it's coming from, then you can make some tweaks. Now, what are the tweaks that you can make once you've identified which hormone's causing the weight gain? Well, it's likely that you probably need to lower the dose. This is actually a really important point, because I would say that a lot of time patients come to see me and they're underdosed. And this is a whole nother video, which is how do you know your hormone therapy is working? If you want a video on that, tell me in the comments below. But they're actually usually underdosed. However, I often see women who are overdosed, and what the overdose is gonna do is probably cause weight gain. So one of the things I would think about is your dose too high. And you might say, well, this is the dose that really helped my X, Y, or Z, my hot flashes or my brain fog or my joint aches and pains. But then you gotta combat that with, maybe if we do dial it down, some of that weight will come off, and that's actually my happy spot. You know, I do a lot of FDA approved hormone replacement therapy. In fact, that's all that I do. And when my patients get to a really good spot, they say, do you think we could add more? Isn't more better? And I always say, no, more is not always better, because often once you get to this point where hormone therapy works really well, if you keep going, you start to kind of actually go down the other way and actually have symptoms from those hormones being too high. So I would definitely recommend you think about the dose. You might also want to have your doctor think about the formulation of the hormone therapy. Now, this is a little bit more nuanced, but let's talk about, for example, the different formulations of progesterones. Micronized natural progesterone, or AKA Prometrium, can often cause a lot of water retention. So you're not actually gaining adipose tissue. In fact, it would be very unlikely that you gained fat tissue in a few weeks. It's actually more likely that it's stasis of fluid or it's lymphatic drainage that's not moving. And actually, micronized natural progesterone, or Prometrium, it's kind of a big culprit of this. So you might want to try switching formulations to a synthetic progestin, which is a wonderful idea. They are FDA approved and safe, and that's why they're on the market, because there's not one size that fits all. I've had patients where I switched from Prometrium to something like norethindrone or agestin, and that gets rid of the water retention, the bloating. They feel like they lose that weight and they feel so much better. And lastly, sometimes even changing the route helps. So maybe you've been on oral, and if we switch you to a transdermal, that can help. So here's what I want to say. Hormone therapy in studies has actually not been shown to cause weight gain, and most of my patients actually nearly all of them, because I don't like weight gain as a side effect and I do not stand for it either. Most of my patients either have a null effect from their hormone therapy or really actually feel like it's the key that actually turns their metabolism on and helps them lose 5 to 10 pounds. Studies show that to be true. The biggest study, which is the Women's Health Initiative, and that women who take hormone therapy have less diabetes. So actually the insulin, that hormone, works better and helps you actually maintain or lose weight when you're on hormone therapy. If you feel like it is causing weight gain, it is likely not adipose tissue, but there are absolutely easy ways to fix it. Stop your HRT and slowly do hormone stacking with one hormone at a time. You might need to dose adjust, and if anything, turn some of those doses down, change the formulation, or change the route. If you'd like to work with me and my team, definitely check out our links below. You can go to jointhecollaborative.com. We have just the most amazing clinicians who know absolutely everything there is to know and going to ensure immense success for you. If you're a clinician and you want to work with me, definitely go to the Hirsch Academy. Or if you're a healthcare professional, if you're a nutritionist, if you're a fitness expert, if you're a social worker, if you're a mental health provider, we have courses to teach you all of this as well, because you are actually on the front line. Definitely binge all my YouTube content. I've got a podcast as well, and definitely subscribe. Thank you guys so much for following along, and I'll see you